Hi, my name is Carissa Brown, and this is my One Health seminar presentation on brucellosis. So what is brucellosis? Brucellosis is an infectious disease spread from animals to humans by the bacteria Brucella. There are four different types of this Brucella bacteria. There's Brucella melitensis, which is the most common cause of the disease in humans. There's Brucella abortus, Brucella sui, and Brucella canis. It is one of the most widespread zoonotic diseases in the world. It can affect both humans and animals, leading to significant morbidity rates, especially in developing countries. It's transmitted to humans via direct contact with infected animals or from contaminated animal products. The most commonly affected animals include sheep, cattle, goats, pigs, camels, and dogs, among others. Transmission. Transmission of brucellosis typically involves the consumption of unpasteurized food products. It is the most common mode of transmission. It involves eating or drinking unpasteurized milk or dairy products, as well as raw or undercooked meat. If the milk from infected animals are not pasteurized, the infection is transmitted to these individuals who consume either the milk, cheese, or any type of dairy product. It can also be transmitted directly through skin wounds or through mucous membranes. Bacteria in the blood, semen, or placenta of an infected animal can enter the bloodstream through open wounds in the skin or mucous membranes via contact with infected animals. Individuals who have occupations that require close contact with animals or animal excretions are at an increased risk of contracting the disease. These include veterinarians, meatpacking plant employees, or slaughterhouse workers, to name a few. Hunters are also at risk of transmitting the disease if they come into contact with an infected animal while hunting. Another mode of transmission is via inhalation. Breathing in the bacteria that causes brucellosis may also lead to infection, and the risk is generally greater for people in laboratories that work with the bacteria. Slaughterhouse and meatpacking employees have also been known to be exposed to the bacteria and ultimately become infected via inhalation. So what are the clinical manifestations of brucellosis? So brucellosis has an incubation period of basically between 5 days to 6 months. The typical average onset of the infection is between 2 to 4 weeks. Symptoms of brucellosis may show from a few days to months after initial infection. The symptoms are typically flu-like, and they include fever, chills, sweats, loss of appetite, weakness, fatigue, joint, muscle, and back pain, as well as headaches. Brucellosis also has the potential to become a chronic infection with symptoms persisting for years. Symptoms of chronic brucellosis include chronic fatigue, recurrent fevers, arthritis, endocarditis, spondylitis, which is an inflammatory arthritis, depression, and neurological symptoms. I'm just going to take a minute to also talk about brucellosis and pregnancy. If a pregnant woman contracts brucellosis or is exposed to brucella infection, it places her at an increased risk of spontaneous abortion, especially during the first and second trimesters. It's associated with adverse effects both resulting in fetal and maternal or neonatal death. Diagnosis. So diagnosis of brucellosis involves clinical, bacteriological, and serological tests. So apart from figuring out or determining the clinical picture or presentation of a patient who might have been infected by brucella, you also want to do bacteriological and serological tests. Serology is actually the most useful diagnostic procedure approach, and this involves testing a sample of blood, or you can even test a sample of bone marrow for the brucella bacteria, or you can test the blood for antibodies to the bacteria that can help with diagnosing the infection. If you detect complications of brucellosis, you might have to do additional tests, including X-rays, CT or MRI, cerebrospinal fluid culture, or echocardiography to just make sure that the patient does not have any type of endocarditis. What are some of the high-risk groups of people that might contract brucellosis? So individuals who work with animals or come into close contact with infected bodily fluids from animals are at an increased risk of contracting brucellosis, and these include veterinarians, dairy farmers, ranchers, slaughterhouse workers, hunters, and microbiologists and other laboratory workers. Prevention. So the main form of prevention of brucellosis is to avoid unpasteurized dairy foods, including milk, cheese, ice cream, or any other type of dairy products. You also want to make sure that you cook meat thoroughly, cooking the meat until it reaches an internal temperature of 145 to 165 Fahrenheit is ideal. And also when you're eating out in restaurants, make sure to order all meat well done. For people who might be working with animals and infecting animals or handling sick or dead animals and animal tissues, you want to make sure that you also always wear rubber gloves at all times. Taking safety precautions in high-risk workplaces is also ideal to preventing this disease. So if you're a lab worker, handle all specimens under appropriate biosafety conditions and treat all workers who have been exposed promptly. If in slaughterhouses, there are also protective measures such as separating the killing floor from other processing areas and use of protective clothing to avoid contact of the infectious material or infectious animals with humans. And lastly, you want to vaccinate all domestic animals. So case management. The goal of management of brucellosis involves control of symptoms to prevent complications and relapses. The first thing you want to do is supportive therapy for the patient. Also, when they come into the hospital or wherever they present, you want to take appropriate precautions such as wear masks, gloves, and eye protection if you're going to take respiratory samples or handling any bodily fluids, because it can be transmitted that way. And specimens from the patient should be handled in the lab under biosafety level 3 conditions. In terms of treating the patient, antibiotic therapy is usually ideal. Drugs that display clinical activity with low relapse rates include doxycycline, gentamicin, streptomycin, rifampin, and trimethoprim sulfamethoxazole. And this is just a table showing some of the treatment options for brucellosis. So in adults and children over 8 years, you want to use combination therapy to decrease the incidence of relapse of brucellosis, which can possibly happen. So using oral doxycycline or rifampin for a minimum of 6 weeks is ideal. For children less than 8 years, you want to give them oral trimethoprim sulfamethoxazole divided in 2 doses for 4 to 6 weeks. You can consider adding rifampin along with this. In pregnancy, it might be a little bit difficult because tetracyclines like doxycycline are contraindicated for pregnant patients. So you want to consult an obstetrician if there's a pregnant female who might have contracted the disease. And then in complicated cases, there's a variety of interventions that can be done. For life-threatening complications like meningitis or endocarditis, you want to extend the duration therapy of any of the antimicrobials to 4 to 6 months. The case fatality rate for brucellosis is typically less than 1%, so even though it has the ability to become fatal, the fatality rate is very low. And that's the end of my presentation on brucellosis. Thank you.